everyone. My name is Katie Brumfield. I am the Colorado School of Public Health Career Services Specialist. And today for Coffee and Careers, we're talking to Abhi Rauniyar. And Abhi graduated from our school August 2020 with his MPH in Global Health and Epidemiology. Hi, Abhi.
Hi.
How are you?
So nice to see you. Good, good.
I know. I feel like we just met at the brewery.
Yeah.
Like yesterday.
Just yesterday after the leadership conference. Yep.
Yeah. So anyways, Abhi, tell us what is your current job title and where you work, and a little bit about your job.
So, hi everyone. I'm Abhishek Rauniyar. I usually go by Abhi. And so currently I'm working with the Colorado Department of Public Health and Environment, contact investigation, contact tracing group. And I'm working as an epidemiology branch manager. I serve Region 4, which I have about 21 counties under me. So I try to assist all those counties with the CICT support and sometimes outbreak investigation and things like that. So the majority of my work basically to support the investigators that we have doing contact investigation, contact tracing. I was also in the small team that assisted with the new variant outbreak related contact tracing. So basically there's an outbreak and the county needs help. We try to put together a team and do this investigation within 24 hours. So that's majority of my work. I have several of CSP students, which we try to mentor and try to assist them with how they can get ahead, they can find careers along depending on their concentration and stuff. So.
Wow, that's great. Can you tell us a little bit about your career path? What led you to public health? Why did you choose epidemiology and global health, and how you got to your position today?
So the truth is, 4 years ago, if you had asked me what's epidemiology, I had no idea. I didn't know what that term meant. And I think that's a struggle of a lot of people coming from minority background is there are a lot of careers that we want to pursue, but we're not even aware of that term or like what it means. Where do I find that information? How do I get there? And I think that's a lot. I had a lot of those questions as well. How I got into public health kind of goes back. So I grew up in Nepal. I came to the United States when I was, I think about 16, 17 years old, starting junior in high school. But while living in Nepal, what I didn't really thought it was a problem, but I came to the United States and then I realized it was such a huge problem that people were dying just for little things that they could have been prevented. It could have been, just a primary care clinic or a small urgent care clinic, close by could have prevented that death or, or the morbidity and stuff. So I think I realized a lot of that when I came here, and I was able to compare what it looks like to have a, better healthcare system and stuff. And that's what kind of really got me into public health and, try to pursue that and try to, I also want to be a physician one day and then kind of bring those together to, fulfill and bring those changes even back in Nepal and then globally. I think, I'm glad that what we have here is amazing, but I think we're able to, we can expand that in the entire world and, make sure everybody gets a fair share. So I think a lot of these kind of led me into go into public health. And when I was graduating college, I learned about public health, and I wanted to do something with public health, but I didn't really know much into like what education, what goes into it. So I started with a certificate program just to understand what's in there. And then I really liked epidemiology. I always enjoyed math. So this was a good way for me to combine math and biology or math and physiology and stuff. So I think, I really enjoyed it. I was like, I'm going to go apply for, a master's and, pursue my master's. And I think when I was getting a master's done, the pandemic happened. And right at that time, I was taking infectious disease epidemiology class. And that kind of led me into thinking more, kind of explore more into infectious disease epidemiology. And I started as an investigator, really enjoyed it. And I think my manager saw that I was, and I was enjoying this. I was, I really liked what I was doing. And I think that helped me move up. I believe within 5 months, I was able to go from an investigator to assistant branch manager to an epi branch manager. Um, I'm really grateful for the opportunity, but I think this is not the end. This is just a starting for my career. So I hope to fulfill all my dreams that I had since I was a kid, and go further.
It's so cool to hear you talk about the progression so quickly. I remember meeting you. You were always one of those students, though, that you asked a lot of questions. You wanted to get involved. You did a lot of things while you were a student that I think really helped you prepare your career. Can you talk about some of those things?
Yeah, I think, I think the way I am right now, trying to ask a lot of questions. I think it comes with not having those resources sitting with you. It really leads you to like go look for those resources, dig into and find those resources. And I think when I came to the United States, my parents basically left me and was like, my job's done and figure it out. And I think that's what kind of like always led me to like, well, I have to figure it out myself. So might as well just go dig in there. And like, I think one of the biggest advice I would give everybody is like, don't be afraid to ask questions, because the most they can tell you is no, but at least you got farther, because, out of the 10 no's, there might be 3 yeses. And I think that's really important. And when I was in the master's, when I joined the master's program, I was not really aware of what's in there, but when I started digging a little more in there, I realized that the school actually has a lot to offer in terms of conferences, meetings, which you can do, and a lot of them actually pay for. I didn't have to pay. I can tell you in last 7 years from bachelor's to right now, I've probably been to like 7 different conferences and haven't paid for a single one of them. So there are resources out there. It's kind of like sometimes hidden and you don't really find it. So you just gotta, dig in there and find people like, people like Katie. And I think you just get like what's out there. And, I think sometimes just putting it out there, hey, I'm interested. They will remember you. They will come to you when there is an opportunity. And I think that's what I was really focused in finding those opportunities. And everybody around me, I always enjoyed everything I did, even if it was a little, going and managing a conference, or big as, doing an outbreak investigation. I really put my heart into it. And I think, that really, my managers saw that, and a lot of people around me saw that. And I think they wanted me to take me further, lead me to more opportunities. So I think that's been a key point of my, where I am right now and where I want to be.
I agree 100%. I mean, you really dove in. You went to conferences, you planned our Emerging Leaders Conference, you were part of our leadership group, and I think you even did the mentoring program.
I was not part of the mentoring program, because I think I only spent 1 year in my master's, one point something, because I was a certificate program. So I wasn't really involved with the mentoring program.
Yeah, I think that's where we had a ending or kickoff event at the brewery, and that's where we were talking. And I just loved how you were so persistent, and you always asked a ton of questions, because you had so many doors opened, I think, because of your persistence and your curiosity, trying to learn about public health. Like you said, you didn't know what epidemiology even meant, back then. And I think that's true for a lot of people that get in public health. But you also worked very hard while you were a student. So how did you juggle? Tell everyone what you did for your job while you were a student, and how you juggled your time.
So this kind of goes back when I was in college. I always just thought that everybody had to do this. So I was working about 35 hours a week since I was a freshman in college. And since then, I've always had to work that. So it was honestly during my master's, it was actually not as bad as it was in college, because during my master's, I actually had a job on campus. So, and my boss, I was working in a lab as a professional research assistant. My boss, he was really, flexible with my schedule. And so I could just go and run to my class, finish that class, come back and work. So it kind of worked out really well. But I think, the entire time I wasn't trying to look at my job as like, it's a separate thing that has nothing to do with my career or life, I was actually looking at it like, they're both different kind of education. They're both, I'm learning things from both of those things. And I think I always wanted to bring both of those together. And I think epidemiology was, a great way to put that together. What I've learned in my lab and my job has been very valuable right now with this pandemic, learning about the different tests we have, learning about the virus, keeping up with that, literature review, all of that is very valuable. So I think I'm not gonna lie, I would not wish this on anybody to work 35 hours a week when you're in college or in graduate school. But I think, when you have to do it, there's some of us, we just don't have a choice and you have to pay your bills. And I think just managing, maybe it might take not 2 years, but 3 years. But I think it's there's a light at the end of the tunnel. And I would just keep, looking for the light.
And when you started the MPH program, you didn't have any experience in public health, did you?
No. I did not. Actually, I had almost zero experience in terms of public health. I did volunteer at a lot of community volunteering in terms of biology and pre-health, but in terms of public health, I actually had no experience. But I think when I getting out of public health, I definitely gained a lot of experience I was able to go to India, do my practicum with one of my best mentor, Dr. Molly Lamb. So it's all of that really served. And it was very enjoyable. I actually enjoyed everything I was able to learn from her and all the field work I did with her.
Yeah, that's so cool. What would you say helped the most in terms of your education at the Colorado School of Public Health prepare you for the career you're in now?
So in terms of education, I would say, the professors and, even the administrative staff, I think maybe college is too big and you just don't get that, direct help sometimes. I really saw that in my master's program is that the professors were really, willing to help. They would take an extra step, to try to help you and go extra further. Like, there's this literature that you can run, and they will actually try to not just lecture, but it's in terms of like try to understand, like, let's investigate this together about this, a certain matter. So it was a different kind of education I received there. It was more practical. I feel that I was able to apply that a lot more, what I learned at Colorado School of Public Health, to the outside world. And I think a lot of that really helped me connect the school to the practical, like when you're actually out in the field. So when I actually went from my master's program to my job, it didn't actually feel like a big pressure, like this was just books and this is just practical life. It was actually, it felt like a smooth transition because I was able to transition all of that over. It was a very practical type of education, and the professors were amazing. They're always great and willing to help you any way they can.
Yeah, that's awesome. In your current role, what would you say like the top 3 skills you use are?
In terms of my career path, I think one of the best one I would say is networking is definitely, as much as education and degree are important, I think networking takes you just your odds from like 1 to 20 to like, 1 to 3 or something. Networking has really helped me in terms of get where I am. And I think when I talk about networking, it's not just when you need the job, but just keeping in mind that just having that one mentor, having that like, hey, just, I'm this, I'm trying to plan, this is my career path I'm going forward for. Keep in mind if you see something. So I think they remember that. And even 6 months later, they will come to you. So I think that has really helped me. I think I've always been a person where, there's a lot of ups and downs that came in my life, a lot of places where I'm like, why am I working too hard? I should just, quit this and I can't do 2 things at a time. So I think just recognizing that it is tough, but there is light at the end of the tunnel. And I think there's help out there. There are people who are willing to help you, and I can be that person for somebody who doesn't think that they have help. I'm willing to do that, but there's help out there, and look for the help, but basically trying to see the bigger picture to see what's at the end of that. And then third, I would say, just recognizing the support that you have around and utilizing that.
Mm-hmm.
I think, a lot of what I did didn't come from a big, something that I had to do extraordinary. It was something that was just around. I just had to look for that support. And either that came from, the career center, or that came from my boss, my previous boss, or they came from my professor. I think just looking for those and then analyzing what you want to do, which one you want to take. I was very anxious about finding a good practicum or good
Mm-hmm.
capstone. And I just started with, just going to Dr. Lamb. She was my advisor. And she just started me, she would like talk to me for a little bit about yourself. And I told her I spoke Nepali and Hindi and and other languages. She was like, let's go to India, and we can do all of that. And she was like, and she recognized that like I was a huge help for her project, but her project was a huge help for me to fulfill my current practicum. So it's like just recognizing little things around you can be really beneficial for you. And it's not that you don't actually just have to go all the way to CDPHE or all the way to CDC to find that.
Yeah.
Sometimes it's just right around the corner.
Yeah,
So
that's good advice. So in your current job right now, that's got to be pretty stressful right now with the pandemic and this new strain. How are you managing your stress, and are you working, 40 plus hours? Like, how is that going?
So I think when I first started as assistant branch manager, I did have to work a little over 40 hours. I think it was just trying to make those staffing changes, get fully staffed took us a little longer. So I had to work a lot more than 40 hours a week. When the new variant came out, that was a little bit, just an emergency response kind of thing. It's kind of like an ER getting flooded by something that just came on and everyone just running around. That's kind of, and then, but, I think we had a great team and we were able to work through that, be very supportive. There were people, that weren't off day, and they would work on those off days to just kind of like support everyone that were needed. I was supposed to be off on the first, but I had to work on the first because of all of that. So I think having a good group of support, I think really helped that.
Yeah.
But now our team has been really nicely staffed. So I've been getting a lot more sleep, and definitely working just now 40 hours or sometimes even less, So
Yeah, it sounds like this pandemic is pretty much shaping your career.
Yeah, right where it goes, I follow the pandemic.
Yeah. Hopefully we don't have another one anytime soon. So in your current job, what are the tasks or things that you do, is it data analysis? Is it primarily a lot of data analysis, or is it a lot of, what's the majority of your work consist of?
So majority of my work kind of revolves around contact investigation, contact tracing. Occasionally I do some data analysis, some data support, analytic stuff, but mostly revolves around infectious disease investigation.
Okay.
My job personally, I think I'm there to manage investigators that are working directly with me. So I try to support them with contact investigation, contact tracing related supports. We also try to support with outbreak investigation as they go.
Okay.
School related cohort investigation. I think those we try to support a lot for. But basically trying to like be ready for any outbreaks that are coming in, just get a team together and get it going, like brief them what they're doing. I think a lot of us managers, we have to kind of like self-teach this. I think those of you who are in infectious disease class, you probably, I learned about all the viruses, but I only, learned a little bit about the COVID-1. I think we're barely just getting started with SARS-CoV-2, and it was really evolving. We actually didn't even think it was going to go pandemic, but it did at that time when we were in the class. But I think, a lot of our time actually basically educating ourselves based on what's out there in the literature, what the new guidances are, and making sure that that's being translated to the investigators and then the community. And yeah, so a lot of my work revolves around that.
That's great. That's very important work. And thank you for that, because I think Colorado's doing pretty well.
Yeah, I think we're fortunate. I think a lot of our they're working. I think public health interventions are definitely working, and people are doing their part for the most part. I think it's definitely helping keep the numbers down.
Yeah. Okay, one last question. For anyone that's watching this video that might be thinking about public health, or they heard about public health, but they're not totally sure if they want to pursue a degree in it, what type of advice would you like to give to them?
I think public health is a very rewarding career, not just in terms of, they're actually, I think they're well paid in most places. There is a lot more you can do. It's not just, work for CDPHE or work for CDC, but I think there's a lot more opportunity. I think before I came to CDC, I was given actually a few opportunities at consulting companies. They were actually paying me well too. And the experience I was gaining and everything was really amazing too. So there's actually a lot more that you can do with the public health degree that a lot of times we're not really aware of. And it's kind of like you just have to dig into that. A lot of people go into pharmaceuticals and with this and support them. Especially, I think I can speak personally with epidemiology. I think right before, I think a few months before I graduated, I got a training at Harvard for environmental health risk assessment. And I recognized there that I think I was the youngest one in that group, but they all kind of liked me because I was an epidemiologist, and they seemed to see the epidemiologists kind of know a little bit of all their fields and how we analyze all their stuff. So I think this was, it's a great career. Sometimes you can pair it up with something else and it makes it'll boost your career too. So it's emotionally rewarding too. End of the day, I think I chose to come to CDPHE for this job because end of the day, even though I work for like 60 hours a week, I'll feel really relaxed because like I did something that it's meaningful for me. And I think that's end of the day, that's like, it's not just the money that's coming in my bank, but it's also like the feeling that I get out of, how do I feel at the end of the day for my job? So putting all of this together, I think public health is a great career path. And I encourage you all to join this. I encourage you all to get with Katie and explore a lot more.
Thanks. Well, thank you so much for chatting with us today. It's been so cool to see your career grow, and I can't wait to see where it goes from here. So I hope you keep in touch, and thank you for all your hard work in public health.
Thank you, Katie, and thank you all for watching.